Hey Antoinette, my computer is going really, really slow, so I figured I would just make you a quick video to show you some things that you can do. I've been trying to upload stuff to your email for like 30 minutes and my computer's freaking out. All right, a couple things you can do for your hips and lower back. One thing is going to be to stretch all of the muscles in your legs. So starting with your quads, now I would recommend being a little warmed up for this. So maybe take like a light jog around the neighborhood or something before you go into this stuff. But you can hold on to something, but you're going to put your knee right here. And what you want to do is you want to push back here. Make sure that your knees are both lined up and that you're pushing your hips forward. That way you're going to get not only a stretch in your quad, but you're going to get a stretch in your hip flexors. And it might be tightness in your hip flexors that's causing some of the problems. Usually hips and low back stems from something going on in your hip flexors. So another way you can stretch it is you can be down here in a lunge and you can, with your knee on the ground, and you can push your hips forward. Another way to make it just a little bit more intense is you can be up in a lunge right here and then just stick your butt, just really push your butt underneath. It's going to cause a lot of, you're going to feel it a lot in that hip flexor of that leg. Another thing you can do to really kind of stretch and open everything is a butterfly stretch. So you're just right here. One thing you want to do is you just want to lean forward. You don't need to round your back at all. Just have your back up nice and flat and just push forward, just lightly pushing those knees out. You're going to feel a good stretch here. Another one is you can be back here. This is a really, really nice glute stretch. You can be down like that. You can be sitting up nice and light. And you can also take it up here, all right? So we're getting all of that worked out. Hip flexor is going to be the most important, but glutes and all that are going to be important as well. A good thing for your lower back is a child's pose. There you're just, you want this to be an active stretch. So really take your hands out nice and far and push your hips back into your heels. Oh, yeah, that one feels great. So that's a good one for your lower back. I'm going to show you some foam rolling exercises that you can do, but I would hesitate. I know that it might be pain in your lower back, but I would steer clear of foam rolling your lower back. You're only really supposed to foam roll your flank, and like for me personally, it's only about this much space. So I don't want it. It's just, you can hurt yourself. And a lot of times, like I said, a lot of times it's tightness in your hip flexors, your IT band, or somewhere in your legs that can actually be exacerbating or even causing the soreness. So I'm going to show you how to foam roll all of that. And I lent my foam roller, I have like 100, and I lend them out all the time. So I'm going to show you on a wine bottle, okay? Do not use a wine bottle. But I'm going to show you on a wine bottle. You want to have something a little bit longer than this, but you want to have it nice and tough. So the foam rollers that I use are really redneck foam rollers. They are just pieces of PVC pipe. So if you get a piece of PVC pipe, there's some scraps that are about this long and about like this in diameter. I think it's 3 inches maybe. That should be good. A lot of the foam rollers at Academy and stuff like that are just too squishy. You want something that's hard. If you use a PVC pipe, some people like to put tape over it to sort of make it not as intense of a feeling. I just straight up use a PVC pipe. So you're going to want to do your quads, and your quads, since it ain't quad, there are 4 muscles actually in there. So when you're foam rolling, you want to make sure that you get all 4 of those muscles. So you're going to place your foam roller. I'm going to move this. Okay, so you're going to place the foam roller right over top of your knee. You don't want it to ever go on the joints. All right, so you're going to be here. If you have a little short one like this, you can drop your back knee down. If you have enough room on there where you can put both legs on there. But you're just going to slowly roll back until you get to your pubic bone, and then you're going to roll up here. All right, keeping your abs nice and tight. It's a great ab workout too. Then you're going to want to turn your toes out like a ballerina and turn your toes in like a pigeon. So pigeon toes. If you find a spot that's particularly like, ugh, hang out on that spot. I've been brought to tears before. It's okay. Afterwards, it feels so amazing. So just hang out on that spot for about 30 seconds. And if you want to, so say it's right here, right above my knee, you can also bend it and let it go. Bend it and let it go several times. But I would do probably 7 to 8 passes, hanging out on those tough spots, on those big knots, several times. Okay, and that's 7 to 8 passes per, like, one with your feet neutral, one with your feet turned out, and one pigeon-toed. Another really, really good thing to foam roll is your IT band. So it's basically this just thick band of muscle fascia right here that connects your hips to your knees. And a lot of knee, low back, even some ankle and hip pain can come from tightness in the IT band. So the IT band, you want to be a little careful. So wherever the end of your butt is, you're going to make like a line right here. When you're foam rolling your IT band, you don't want to go up past that line on your butt because you have a Versa sac right here. It's a fluid-filled sac right at your hip. And if you roll all the way up your hip, you're likely to hit that Versa sac, and then it's going to hurt, but not in a good way. So a lot of this stuff is going to cause a little bit of discomfort, but we don't want you to feel sore for a couple days afterwards. So this is what you'll do. You'll be in a side plank, in a good side plank. So elbow right underneath your shoulder. I'm drawing a line from the bottom of my butt to the hip. I'm just going to roll down. Now this one, I will warn you, is intense. And then as soon as I get to where my butt hits, I'm going to just roll forward just a little bit and go back. Roll forward just a little bit and go there. Consequently, these are really nice ab exercises. All right. You're also going to want to get your booty. So you're going to be in that same position where you were like doing the laying down stretch. But here you're going to just roll. On some people this is longer than others, but make sure again you don't want to roll right on top of the bone, just the nice meaty part of your booty. All right? Then you can do it with the other side too. So whatever leg is up, that's the side of the butt that you're getting. Now, I know that you're experiencing discomfort in your hip and your low back, but sometimes it can shoot down all the way into your calves, and some kind of dysfunction or tightness in your calves cannot be sending it up. So all of this stuff is connected. If you do have to go see a chiropractor, they're going to tell you the same thing, that all of these different parts are all connected. So sometimes it's the way people are doing a squat that influences something way up here in their in their low back or in their hip flexors, or something in their hip flexors is influencing an ankle injury or something like that. So it's good to just roll all of your leg muscles. So here your calf, you're just going on the meaty part of the calf. Again, little pigeon toe, come out just a little bit. Remember, you don't want to foam roll right on any bones. So you don't really want to do the front of the leg. And I think that's it. So if that one doesn't hurt, you can always stack your feet up on it. And I think that should be it. So stretch your hip flexors. Those are just these muscles right here. So remember the lunge, this stretch, this stretch. You can also lay on your foam roller, your back on the foam roller here, and stretch out this way. That can get a stretch there, but if it starts to hurt your lower back at any point, laying on the ground and doing this pretty much gets the same effect. If you have any questions about any of this, please feel free to call or text me. And if we need to set you up with an appointment, we absolutely can. Kyle will do free injury assessments for all our campers. So I got to run, but I hope all of this helps. and we're gonna get you back out. You're gonna not feel poopy, and I'll see you tomorrow. All right, let me know how this helps.